Have you ever wondered why your erections aren't as firm as they used to be? Many men think it's all about testosterone or blood flow. But here's the hidden truth. The strength of your pelvic floor muscles plays a significant role. These muscles lock blood inside the penis and keep you hard. Just like any other muscle, they weaken with age if you don't train them. That's where Kegel exercises come in. Many people think Kegels are only for women, but I have seen men in their 50s, 60s, and even 70s transform their performance simply by strengthening these muscles. Today, I'll show you the 5 most effective Kegel exercises that you can do at home without any equipment to help you achieve firmer erections, better control, and improved bladder health. Stay with me until the end because most men skip the final move, but it's the real game changer for lasting firmness. Lie down comfortably on your back with your knees bent at about a 45 degrees angle, your feet flat on the floor, and positioned hip-width apart for optimal stability. Place your arms gently at your sides with your palms facing down, allowing your body to feel fully supported and relaxed. Take a moment to settle into this position and allow your breathing to become natural and steady. From this position, focus your attention on your lower back region. Gently tighten your abdominal muscles. Imagine pulling your belly button towards your spine, pressing your lower spine firmly into the floor as if ironing out any space or arch underneath it. At the same time, tilt your pelvis slightly upwards, just enough to engage your muscles without straining or causing discomfort. You should feel a subtle but distinct contraction in your lower abdominal and deep pelvic muscles. Initially, hold this position for 3 to 5 seconds, breathing steadily through your nose, and then slowly return to the starting position under control. This exercise may look simple, but it is remarkably powerful for your sexual health. Not only are you activating the pelvic floor muscles, you are also connecting them with your lower abdominals and creating what experts call co-contraction. These are the muscles that contract rhythmically and lock blood inside the penis during an erection, acting like a natural ring. By practicing this move daily, you're training those muscles to work together on command, building both strength and coordination. Another crucial benefit of the pelvic tilt is body awareness, or proprioception as physical therapists call it. Many men don't realize they can consciously control their pelvic floor until they start practicing this foundational movement. It's like discovering a muscle you never knew you had. Over time, you'll begin to feel exactly which muscles are firing, where they are located, and how to engage them more effectively when needed. This enhanced awareness can lead to firmer, more reliable erections, greater control during intimacy to delay ejaculation, and significant improvements in bladder strength to reduce urgency and frequency. Start with 10 to 15 repetitions, holding each tilt for a few crucial seconds. Focus on quality over quantity. It's better to do 10 perfect repetitions than 20 sloppy ones. As your muscles grow stronger over the coming weeks, gradually increase to 20 or even 25 repetitions consistently. This is key. You'll notice that your body responds differently. It will feel as if you are gaining firmness rather than losing it. Some men even describe it as regaining control over a part of their body that they thought had been lost to aging forever. Next, we have the prone stretch. For this one, lie face down on a comfortable mat or carpet with your legs fully extended and your elbows placed directly under your shoulders, almost as if you were beginning a gentle cobra pose or preparing to read a book while lying down. Your forearms should be flat on the floor, parallel to each other. Lift your chest slightly off the ground, keeping your neck neutral and your gaze either straight ahead or slightly downwards to avoid neck strain. From this position, engage your abdominal muscles by gently pulling your belly button in towards your spine. Imagine trying to create space between your stomach and the floor while lightly contracting your pelvic floor. Imagine gently lifting those deep muscles as if you were stopping the flow of urine. This move may not look particularly demanding to an observer, but the internal benefits are unique and powerful. It lengthens and stretches the front abdominal muscles, including the hip flexors, which often become tight from sitting, while forcing the deeper stabilizers, the pelvic floor, the transverse abdominis, and the lower abs, to contract in perfect harmony. This balance of stretching and contraction is what makes the exercise so effective. It builds not just raw strength, but also flexibility, endurance, and muscular coordination, all of which are essential for optimal sexual performance and maintaining erections. Many men who incorporate the prone stretch into their daily routine regularly report a reduction in chronic lower back tension and significantly improved posture throughout the day. Most importantly, they experience a stronger, more conscious connection to their pelvic floor during intimacy. This enhanced connection means that when the time comes, the neural signals between your brain, muscles, and erection are clearer, faster, and stronger. It's like upgrading from dial-up to broadband for your nervous system. Initially, hold this stretch for 20 to 30 seconds at a time, focusing on steady diaphragmatic breathing and gentle but deliberate muscle activation. Don't hold your breath. Oxygen flow is crucial for muscle function. Repeat 3 to 4 times, resting for 10-15 seconds between each stretch. Over weeks of consistent practice, gradually increase the hold time to 45 seconds or even a full minute. You will find that your pelvic region feels both looser and stronger at the same time. This is the exact combination you need for lasting firmness, better blood flow, and superior control. The third move is the kneeling ab draw-in. Start by getting into the tabletop position on all fours, with your hands directly under your shoulders and your fingers spread wide for stability, and your knees directly under your hips. Your spine should be completely neutral, not arched like a scared cat or sagging like a hammock, but naturally straight. This position alone helps to align your entire body, removing unnecessary strain from the lower back and preparing your core for activation. Now, exhale slowly and deliberately through your mouth. As you do so, gently pull your belly button in towards your spine to flatten your stomach, but make sure you don't hold your breath or create tension in your shoulders. At the same time, contract your pelvic floor muscles. Imagine trying to stop the flow of urine midstream, or visualize gently lifting your testicles or drawing the muscles inside your pelvis upwards. Hold this contraction for 3 to 5 seconds, keeping your shoulders relaxed, your neck in a neutral position, and your breathing smooth and controlled. Then slowly release with control. This movement may look minimal from the outside, but what's happening inside your body is profound. You're activating the deep core muscles, particularly the transverse abdominis, which wrap around your midsection like a natural corset or weight belt. At the same time, you're training the pelvic floor to work in sync. These muscles work together to create spinal stability, improve pelvic circulation, and strengthen the neural connection between your brain and your sexual function. What makes this exercise particularly unique and valuable is the way it links conscious breathing with precise muscle control. By learning to contract on the exhale and relax on the inhale, you're training endurance and coordination, two things that directly translate into greater stamina and control in the bedroom. Men who practice this move regularly often describe discovering a new level of awareness of their pelvic muscles that they never knew was possible. Rather than feeling disconnected or out of control, they can sense and control those contractions more easily, helping them to maintain an erection for longer and delay climax when desired, enhancing both their pleasure and their partner's satisfaction. Start with 10 to 15 repetitions, moving slowly and steadily with full concentration. Quality matters far more than quantity here. Over time, gradually increase the hold to 5, 7, or even 10 seconds as your endurance improves. You can also try variations, such as shifting your weight slightly forwards or backwards, to engage different muscle fibers. The fourth exercise is the bridge abduction. Lie flat on your back on a comfortable surface with your knees bent at roughly 90 degrees and your feet hip-width apart and firmly planted on the ground, about a foot from your buttocks. Place your arms at your sides with your palms facing down to provide support and stability. Take a moment to find your neutral spine position. Now press your heels firmly into the floor. Engage your glutes and lift your hips towards the ceiling to form a straight line from your shoulders through your hips to your knees. This is your bridge position. Hold this position steadily while maintaining good form. Gently push your knees outwards as though you are trying to spread the floor apart with your legs or stretch a resistance band. Then, control your movement as you bring your knees back to the starting point. The movement should be smooth and deliberate, not jerky or rushed. What makes this move so powerful is that it works multiple crucial muscle groups simultaneously and in a coordinated fashion. You're strengthening the pelvic floor muscles, which help to trap and maintain blood inside the penis during an erection. At the same time, you're powerfully activating the glutes, the largest and most metabolically active muscles in your body. On top of that, you're targeting the often neglected hip abductors and stabilizers, which are essential for pelvic balance, stability, and optimal circulation. When these muscles are weak or inactive, blood flow to the pelvic region is often significantly reduced. However, when these muscles are strong and responsive, they act like auxiliary pumps, helping to drive fresh, oxygenated blood to where it is needed most for strong erections. The bridge abduction also effectively trains your body to maintain firmness during movement and under pressure. By keeping your hips elevated while moving your knees dynamically in and out, you're developing the kind of muscular control and endurance needed during intimate encounters. This functional strength directly translates to better performance. Start with 8 to 10 repetitions, holding each outward push for 2 to 3 seconds before returning to center. Focus on keeping your core engaged throughout to prevent your back from arching. As you grow stronger with practice over the weeks, increase the number of repetitions to 15 or 20, or add a resistance band around your thighs just above the knees for an extra challenge and to activate more muscle. Men who consistently stick with this exercise often report not only firmer erections, but also improved pelvic stability and hip mobility. This means less fatigue, reduced lower back strain, and greater control during longer intimate encounters. This exercise is one of the most effective for building a strong, stable foundation that supports both sexual performance and overall body confidence. Finally, the most overlooked but incredibly powerful move, the rocking frog stretch. Begin by getting down on your hands and knees and positioning yourself on all fours on a padded surface or yoga mat for comfort. From there, slowly and carefully widen your knees. Go as wide as feels comfortable without causing yourself any strain. Keep your feet turned outwards so that your inner thighs are fully open and your hips can sink lower towards the floor. Your knees should form a wide V shape. Now, gently lower yourself down onto your forearms, keeping your spine neutral and your head relaxed. You should feel an intense stretch in your inner thighs, groin, and hips, which is exactly what you want. Take a moment to breathe and adjust to the stretch. Once you are comfortable and stable, start rocking your hips forward and back in a slow, controlled, rhythmic motion, almost as if a gentle wave were moving through your pelvis. This move is unique in the world of men's pelvic exercises. It deeply stretches the adductors or inner thigh muscles while also opening up and releasing the deep pelvic floor muscles, which often become chronically tight with age, prolonged sitting, stress, or a lack of flexibility training. When these muscles are tight and restricted, they create a tourniquet effect that restricts blood flow and causes excessive tension in the pelvic area. This makes it significantly harder to achieve and maintain strong erections. By gently opening and relaxing these muscles while engaging your pelvic floor dynamically, you allow blood to flow more freely into the erectile tissue, where it stays when you need it. The rocking motion is particularly important and should not be skipped. It provides more than just a static stretch. It creates fluid movement throughout the pelvis, dramatically improving circulation, promoting lymphatic drainage, and training the muscles to activate and relax in perfect harmony. This balance of strength and relaxation is critical for sexual function. Too much chronic tension in the pelvic floor can restrict blood flow and cause premature ejaculation, while insufficient strength means that blood cannot be retained for firm erections. This exercise helps you to find and maintain the ideal muscle tone. Initially, spend 30 to 40 seconds in this position, moving gently with the rhythm of your breath and breathing deeply into your belly. Focus on relaxing into the stretch rather than forcing it. Repeat the stretch 3 times, taking 20-30 seconds rest between each set. If you find the position challenging at first, don't force it or push through pain. You can modify it by not opening your knees as wide or by placing a pillow under your chest for support. With consistent practice, your flexibility will improve dramatically and you will find the stretch feels more natural and even pleasurable within just a few weeks. Many men notice a significant improvement in firmness, sensitivity, stamina, and the intensity of their orgasms. Some report that this single exercise feels like it unlocks or awakens the pelvic region, enabling them to experience erections that are stronger and more responsive than they have had in years or even decades. Think of the rocking frog stretch as both strengthening and releasing. It is a yin and yang exercise. It builds control while releasing chronic tension and restoring healthy circulation, teaching your body to move fluidly and naturally. Ultimately, it supports both peak performance and lasting comfort. When paired with the other 4 exercises in this routine, it provides the finishing touch. It's the one move that can take your results from good to genuinely great. So there you have it. The 5 best Kegel exercises to help you achieve harder, more reliable erections after the age of 50. These are not quick tricks, temporary fixes, or gimmicks that overpromise and underdeliver. They are practical, scientifically proven exercises that systematically retrain your body to increase blood flow and penile sensitivity, giving you more conscious control over your sexual response. The key to success is consistency and patience. I many have just 5 to 10 minutes a day. Less time than you spend brushing your teeth can lead to noticeable improvements within a few weeks, with more dramatic results after 2 to 3 months of regular practice. Remember, these exercises don't just help with erections. They can also significantly improve bladder control, reduce nighttime urination, alleviate pelvic tension and pain, and boost your overall confidence in your body and masculinity. For best results, perform these exercises daily at the same time to build a habit. Many men find it helpful to do them first thing in the morning or right before bed. Track your progress in a journal, noting improvements in firmness, control, and overall sexual satisfaction. Stay committed. Do these exercises daily without fail. You may be genuinely surprised at how much stronger, firmer, and more youthful you feel. Wishing you health, vitality, and confidence at every stage of life, Dr. Stephanie Roberts. Remember, it's never too late to strengthen these crucial muscles and reclaim your sexual health. If you found this helpful, please share it with a friend who could benefit from this knowledge. Don't forget to subscribe for more evidence-based men's health guidance.